it might be that you are just trying to manage your blood pressure, then the doctor puts you on a pill. No big deal, right? Then, all of a sudden, it starts. Your energy vanishes, you feel weak, foggy, like your body just isn't yours anymore. You wonder, am I overthinking this? But deep down, you know something is off and you are not imagining it, okay? What I'm about to reveal in this video will surprise you. Hi there, I am Nicholas, a pharmacy practitioner. I'm passionate about helping people take control of their blood pressure the smart and informed way. After seeing how confusion and misinformation were hurting patients, I knew I had to step in. This channel is all about giving you the clarity and confidence you need to stay healthy, okay? Before we begin, let me raise this disclaimer. This video is for educational and informational purposes only. Always consult your qualified healthcare provider before making changes to your medication, diet, or lifestyle. Never disregard professional medical advice or delay seeking it because of something you have seen in this channel. So let us dive in. If you are on Losartan, there is something you need to know right now, because it may be doing more than just lowering your blood pressure and not always in a good way. Let's break this down in plain English, because understanding how Losartan works and what it can do to your body could save you from some really uncomfortable side effects. Losartan, you might know it as Cosa, Losartan HD, and many other brands available in the market, is part of a class of medications called ARBs, or angiotensin receptor blockers. Basically, it helps lower high blood pressure and protects the kidneys in people with diabetes. Sounds great, right? But here's the twist. By blocking a hormone called angiotensin 2, Losartan sets off a chain reaction, one that not only opens up your blood vessels, but also changes the way your brain, kidneys, and adrenal glands function. And that's where some sneaky side effects come in. If you are serious about managing your blood pressure day to day, there are a few tools I personally recommend, not because they are trendy, but because they actually help. Whether it's a clinically validated home blood pressure monitor, natural supplements, or even the kind of salt you cook with, I have listed the best ones I trust down in the description section below. I've gone through them carefully, and these are the exact kinds of resources I'd recommend to my own family. When you use those links, you are not only supporting your health, you are also helping me keep this channel going so I can keep supporting you. It's a win-win situation. Please find the tools that I recommend in the description section below to manage your blood pressure naturally. Common side effects of Losartan. Let's start with the one a lot of people don't expect from a blood pressure medication: fatigue. This can show up in more than 1 in 10 people who take Losartan. Why? It could be something as minor as an electrolyte imbalance or even anemia. Yes, Losartan can lower your red blood cell count, leaving you feeling weak, pale, short of breath, and like you are dragging through the day. And here's the tip off that many people miss. If you find it hard to lift things or your muscles feel weaker than usual, it is not just getting older. That is called asthenia, and it may be linked to Losartan, especially if your hemoglobin is taking a hit. Side effect number 2, hypoglycemia. This is something even most doctors don't explain well. Losartan can mask the warning signs of low blood sugar. That is especially risky for people with diabetes. Normally, when your sugar drops, your body freaks out, you get the shakes, start sweating, and maybe even panic a little. But with Losartan, that adrenaline response gets blunted, making the low blood sugar harder to notice until it is too late. Scary? A bit. Preventable? Absolutely. Once you know what to watch for, okay? Side effect number 3, infection and other body reactions. Losartan also seems to slightly increase the risk of urinary tract infection. That means more frequent bathroom trips, burning when you pee, and that constant gotcha go feeling. And don't be surprised if you catch more colds than usual. Upper respiratory tract infection, think of sneezing, sore throat, and nagging cough, have also been linked to Losartan. Plus, some people notice more diarrhea or nausea, especially early on. That may be due to mild stomach inflation, also known as gastritis. If you've been dealing with high blood pressure and feel like you are navigating it all alone, I want to change that. I offer one-on-one private guidance to walk with you step by step through your journey, okay? I'm not just reading from my textbook. I have over 10 years of pharmacy experience and a deep respect for what you are going through. And I'll be honest with you, if there's something I do not know, I'll say it upfront, then consult my network of specialists and get back to you with a real answer. I treat every person who reaches out like a real human being, not just another number in a crowded inbox. Unlike a bigger channels where your questions may get buried, I give each case my full attention until we reach clarity together, okay? So if that sounds like the kind of support you've been waiting for, just check the description below for how to reach me directly. See you there. Then we have low blood pressure and dizziness. Of course, as a blood pressure medication, Losartan can go a little too far. Hypertension, that's blood pressure dropping too low, can leave you dizzy, especially when you stand up very quickly after using Losartan. Have you ever stood up and felt like the room was spinning? That could be postural hypertension, and Losartan may be playing a part. Also, if your liver or kidneys are not working perfectly, the drug may build up in your system, making these effects even worse. Another side effect is headaches and chest pain. Headaches are pretty common too, especially in the first week or two. Usually that tight tension type aches across your forehead. The good news is it usually fades with time. Now, chest pain is more rare, but it's been reported. Some people experience what is called coronary artery spasm, though the exact cause isn't well understood, okay? If you ever feel chest tightness while on Losartan, don't ignore it, okay? So let us quickly recap. Losartan can help lower blood pressure and protect your kidneys, but it can also cause fatigue, weakness, anemia, hidden low blood sugar, infections, diarrhea, dizziness, and many more. But here's the key. Knowing what is normal and what is not helps you and your doctor make smarter and safer decisions. If you are on Losartan and noticing any of these side effects, even the minor ones, don't brush them off. Talk to your doctor. Knowledge is power. Let me tell you something that could change everything for you. I have created a practical science-backed program called the 21-Day Blood Pressure Reset, and it's designed specifically for people like you who wants to take control of their blood pressure without relying solely on medications, okay? Each day, you'll get clear steps, meal tips, and lifestyle strategies that actually work. No fluff, no guesswork. Just real doable changes that can start showing results in as little as a week. So, if you are tired of feeling powerless over your numbers, this course is where you start winning back control naturally. You'll find the link in the description below. Take the step because your health can't wait. See you there. If you found this breakdown helpful, I've got deep dives on other medications too, like amlodipine and other information about your high blood pressure. Don't forget to hit subscribe if you want more clear real talk videos like this one, okay? Thanks for watching and take care of yourself. See you in another video. Bye.